What is the Sulphur Lung Study asthma?
The Sulphur Lung Study is a pragmatic trial. In clinical research, we have traditionally two kinds of methods for exploring the effectiveness or the efficacy of an approach, a treatment of an intervention. Randomized controlled trial, that's mean experimental trial, and observational trial. In between, we have the pragmatic trial. This means that we can use the scheme, the framework of a randomized trial, but we enroll patients as we are treating in our daily practice, and we are using the environment, such as the GPs that are treating their patients. This means that if the randomized controlled trial are essential in assessing the efficacy of a drug, for example, the pragmatic trial are essential for achieving information concerning the effectiveness of this drug in real life. The Sulphur studies was defined in order to assess the effectiveness of a combination of fluticasone and vilanterol versus the usual care in a large population of people living in the Salford, that is a city in the UK. These people treated in the GP center were followed for 1 year and were randomized to this kind of approach. And the final goal was to assess the level of control, and the combination of vilanterol and fluticasone was more effective of the usual care in inducing an improvement of asthma control.
Why is the Sulphur Lung Study relevant to the healthcare decision makers?
We know that in the randomized control trial, we use tight inclusion criteria. This means that the people that we enroll are not the same that we are treating in a general population. For example, concerning asthma, are generally enrolled people with a decrease of EV1 from 80 to 50%. The smoking habits is avoided, and the patient with comorbidities are excluded by the trial. In the pragmatic trial, a broader inclusion criteria are provided. This means that the results of this trial are more applicable in the large population. This provides really useful information for the decision maker in order to support the use of drug with evidence of efficacy provided by the randomized control trial, but also with proven effectiveness data provided by the pragmatic trial.
Why is the access of control so important with asthma?
More than 20 years ago, we moved our attention to the improvement of a single outcome in our patient, for example, lung function or reduction in exacerbation, to a composite score that is named control, that provide us a more relevant information about the treatment and the effectiveness of the treatment, but also the impact of disease on the patient's life. We use for assess the control validated tool, such as questionnaire. For example, in the Sulphur study, as we use the ACT, asthma control test. This kind of tool provides a numerical evaluation of the degree of control, and we know that with available drugs it is possible to reach the total control of the disease. This means that we have a benchmark, and the aim of our treatment in our daily practice must be to reach the total control of the disease, and we modulate the treatment according to this goal. This is so relevant in order to define the severity of the patient, that means the level of treatment necessary for achieve the control, but is also a target that we need to achieve. And nowadays we have new drugs, for example biological drugs, that are devoted to patients that are not able to reach the control with the usual care.